My name is Leslie Moran, and this is a presentation on the risk factors for prevention of cardiovascular disease. I am a community heart and TIA nurse working for Nottingham City Primary Care and part of the Primary Care Cardiac Service. We're going to have a look during this presentation. The aims of the presentation are we're looking at the risk factors for heart disease. We're going to identify modifiable and non-modifiable risk factors. We're going to look at the cycle of change and how much importance we place on change and how confident we are about making that change. We're going to look at some of the figures and numbers around blood pressure and cholesterol. We're going to look at the principles of a healthy lifestyle, and we're going to identify the barriers to making lifestyle changes. Cardiovascular disease is a general term for conditions affecting the heart or blood vessels. It is usually associated with the buildup of fatty deposits inside the arteries. This is called atherosclerosis, and it carries an increased risk of blood clots. It can also be associated with damage to the arteries in organs such as the brain, heart, kidneys, and eyes. Cardiovascular disease is one of the main causes of death and disability in the UK, but it can often largely be prevented by leading a healthy lifestyle. There are three different types of cardiovascular disease. There are many different types of cardiovascular disease, and four of the main types are coronary heart disease, which is where the flow of oxygen-rich blood to the heart muscle is blocked or reduced. This puts an increased strain on the heart and can lead to angina, which is chest pain, heart attacks, where the blood flow to the heart muscle is suddenly blocked, and heart failure, where the heart is unable to pump blood around the body properly. Strokes and TIAs. A stroke is where the blood supply to part of the brain is cut off, which can cause brain damage or possibly death. A TIA, or transient ischemic attack, or a mini stroke, is similar, but the blood flow to the brain is only temporarily disrupted. Peripheral artery disease. This occurs when there is a blockage in the arteries to the limbs, usually the legs. This can cause dull or cramping leg pain, which is worse when walking and gets better when resting. Some of the signs of this are hair loss on the legs and feet, numbness or weakness in the legs, and persistent ulcers, open sores on the feet and legs. We also have aortic disease. This is a group of conditions affecting the aorta, which is the largest blood vessel in the body and carries blood from the heart to the rest of the body. One of the most common aortic diseases is an aortic aneurysm, where the aorta becomes weakened and bulges outwards. This doesn't usually have any symptoms, but there is a chance it could burst and cause life-threatening bleeding. The good news, 80% of these conditions can be avoided. The causes of cardiovascular disease. The exact cause isn't always clear, but there are lots of things that can increase your risk of getting it. These are called risk factors. The more risk factors you have, the greater your chance of developing cardiovascular disease. This slide shows graphically some of the non-modifiable risk factors. These are the things that we cannot change, and some of the modifiable risk factors. These are the things that we can change. So non-modifiable risk factors, we're looking at ethnicity, age, gender, and family history. Modifiable risk factors, we're looking at smoking, psychosocial factors, high cholesterol, diabetes, high blood pressure, and abdominal obesity. We will look at these in more depth in a moment. Risk factors, as we looked at on the previous slide, the only one I'm going to add in here is stress. And we know that stress can be a risk factor for heart disease, and it's quite important that we do everything in our lives, in our daily lives, that we possibly can to reduce stress and think about the things that cause us stress and try to see what we can do to reduce the stress that those issues cause, how we can manage stress. When we're thinking about risk factors, we know that with gender, men are more likely to develop cardiovascular disease at an earlier age than women. We know that ethnicity is important. We know that people from certain ethnic groups have a higher number of risk factors and are more likely to develop heart disease. With diet, we know that an unhealthy diet can lead to high cholesterol and high blood pressure. With regard to alcohol, we know that excess alcohol consumption can also increase your cholesterol and blood pressure levels and contribute to weight gain. We know that being inactive is a risk factor for developing heart disease, and how much you weigh is quite important. And we know that smoking is a very big factor for your risk of developing cardiovascular disease. High blood pressure, high cholesterol and diabetes can all be medically managed. Age and gender. In men, the risk for coronary heart disease increases starting at around age 45. In women, the risk of coronary heart disease increases starting around age 55. Most people have some plaque buildup in their heart arteries by the time they're in their 70s. However, only 25% of those people will have angina, a heart attack, or signs of coronary heart disease. Genetics. Family history. Traditional values and behaviours within a family can impact upon cardiac risk. What we mean by this is that if parents smoke, their children are more likely to smoke. If parents have a sedentary lifestyle, their children are more likely to have a sedentary lifestyle. If parents have poor eating habits or excess alcohol consumption, there is a likelihood that their children could possibly go on to develop these behaviours as well. It's also important, if you have a family history of heart disease, if your parents, brothers, sisters, uncles, aunts have developed heart disease at an early age, it carries a risk for people that they are genetically related to. Ethnicity. In the UK, cardiovascular disease is most common in people of South Asian or African or Caribbean background. This is because people from these backgrounds are more likely to have other risk factors for cardiovascular disease, such as high blood pressure or type 2 diabetes. Diabetes. Diabetes is a lifelong condition that causes your blood sugar level to become too high. High blood sugar levels can damage the blood vessels, making them more likely to become narrowed. Many people have type 2 diabetes and are also overweight or obese, which is also a risk factor for cardiovascular disease. Being diabetic automatically increases your cardiovascular risk. You're more likely to have a heart attack and a lower survival rate. Angina and cardiac symptoms can be harder to diagnose in those with diabetes, and often people with diabetes do not feel pain as severe as those without diabetes. Good diabetic control is paramount. Eat well, be active, give up smoking. Here are some of the additional complications of diabetes: glaucoma, cataract and diabetic retinopathy, all affecting the eyes. Diabetes can affect your kidneys and your circulation, and it increases the risk of heart attack and stroke. The benefits of smoking. With a question mark, because there aren't really any benefits to smoking. The impact of smoking is that it damages the lining of the arteries, leading to the buildup of fatty material, atheroma. The carbon monoxide reduces the amount of oxygen that the blood can carry to the heart and body. The nicotine stimulates your body to produce adrenaline, which makes the heart beat faster and raises blood pressure and results in the heart having to work harder. Blood clots are more likely. Smoking can increase harmful levels of triglycerides in the blood. If you are a smoker, there are many things that you can do to help you to stop. You can start to think positive. Try to imagine yourself as a non-smoker. Making a plan and setting a quit date is very helpful. Consider your diet and alcohol choices. Sometimes cigarette smoking is identified with certain times of day, perhaps after you've had a meal or when you've been for a drink with friends in the evening. Identify when you crave a cigarette and acknowledge that that is the time when you have to have the greatest resolve to keep yourself away from them. You can get some stop smoking support. Currently, Stubit is the service that's available through your GP. You can get moving, keep active. You can make non-smoking friends. Keeping your hands and your mouth busy can be helpful. Make a list of the reasons that you want to quit. Thinking in terms of the benefits of stopping smoking, within hours the heart returns to a normal rate. Within days, breathing, taste and smell improve. Within weeks, blood becomes less sticky and risks start to fall. Within months, the blood flow improves and you have more energy. And within a year, coughing and wheezing will improve. After a year, your risk of heart disease and heart attack will be halved. After 15 years, it will be similar to someone who has never smoked. This information comes from heart.uk. Knowing your numbers. Blood pressure. High blood pressure is an important risk factor for cardiovascular disease. If your blood pressure is too high, it can damage your blood vessels. High blood pressure or hypertension rarely has noticeable symptoms, but if untreated, it increases your risk of serious problems such as heart attacks and strokes. Around a third of adults in the UK have a high blood pressure, although many will not realise it. The only way to find out if your blood pressure is high is to have your blood pressure checked. Everyone's blood pressure will be slightly different, but considering low or high for you may be normal for someone else. If your blood pressure is too high, it puts extra strain on your blood vessels, heart and other organs. And persistent high blood pressure can increase your risk of a number of serious health conditions, such as heart disease, heart attack, strokes, heart failure, peripheral artery disease, aortic aneurysm and kidney disease, and vascular dementia. If you have high blood pressure, reducing it even a small amount can help to lower your risk of those health conditions. It's not always clear what causes high blood pressure, but certain things can increase your risk. You're at an increased risk of high blood pressure if you're over the age of 65, if you're overweight, if you're of African or Caribbean descent, or have a relative with high blood pressure. If you eat too much salt, don't eat enough fruit and vegetables, if you don't get enough exercise or you drink too much alcohol or coffee or other caffeine-based drink, if you smoke, or if you don't get enough sleep or have disturbed sleep. Making healthy lifestyle changes can help reduce your chance of getting high blood pressure and help lower your blood pressure if it's already high. Blood pressure is made up of two readings, the systolic, which is the measurement of pressure when the heart contracts, and it needs to be under 140 mmHg, which is millimoles. The diastolic, this is the measurement of the pressure in the arteries between contractions when the heart muscle is resting, between heartbeats and when it's filling with blood, and this needs to be under 85 millimoles of mercury. What we can do to help keep the blood pressure under control: good dietary habits, reducing salt intake, alcohol within the recommended levels. We can exercise, we can practice relaxation, restrict caffeine-rich products, stop smoking, and if we have medication, we can be compliant with that medication. Cholesterol. There is no one single cause for high cholesterol. Many different factors can contribute to high cholesterol, such as eating a diet that's high in saturated fat, smoking, a lack of physical activity, high alcohol intake. If you have an existing liver or kidney disease, it can also be linked to genetics, familial hypercholesterolemia. Cholesterol is a fatty substance found in the blood, and if you have high cholesterol, it can cause your blood vessels to narrow and increase your risk of developing a blood clot. High cholesterol levels are mainly caused by eating fatty foods, not exercising enough, being overweight, smoking and drinking alcohol. It can run in families. You can lower your risk by eating healthily, getting more exercise. Some people need to take medication. High cholesterol does not cause symptoms. You can only find out if you have it from a blood test. Types of cholesterol. Your GP will look at your cholesterol readings and he will be interested in total cholesterol, the LDL, which is the low density lipoprotein. We can refer to these as bad cholesterol, and the HDL, the high density lipoprotein, which can be referred to as good cholesterol. Your doctor will also be looking at another type of fats within that cholesterol reading called triglycerides. Your doctor will be looking for the total cholesterol to be less than 4 millimole per litre, the LDL to be less than 2 millimole per litre, and the HDL to be more than 1 millimole per litre. Triglycerides need to be less than 2 millimole per litre. Eating well. Have a balanced diet. Over the course of the day, your food intake should be 1/3 fruit and vegetables, 1/3 carbohydrate, which will be bread, pasta, rice, cereals, potatoes, starchy products. And the final third is a mix of some protein, meat, fish, beans, pulses, and a small amount of dairy products and spreads. A healthy, balanced diet is recommended for a healthy heart. A balanced diet includes low levels of saturated fat found in foods such as fatty cuts of meat, lard, creams, cakes, and biscuits. Try to include healthier sources of fat, such as oily fish, nuts and seeds, and olive oil. Low levels of salt. Aim for less than 6 grams or 1 teaspoon of salt per day. As a rule, I would suggest that people try to remove salt from the table and think in terms of having foods that are lower salt content. A healthy diet includes low levels of sugar, plenty of fibre and whole grain food, plenty of fruit and vegetables. Try to eat at least 5 portions of fruit and vegetables a day. Alcohol. If you drink alcohol, try not to exceed the recommended limit of 14 alcohol units a week for men and women. If you do drink this much, you should aim to spread that drinking over 3 days or more. So try not to binge drink. A unit of alcohol is roughly equivalent to half a pint of normal strength lager or a single measure, 25 ml, of spirit, or a small glass of wine, that's 125 ml. That will be about 1.5 units. Your GP can give you help and advice if you find it difficult to cut down on your drinking. Try to have several days during a week when you don't drink. And look at the alcohol content of what you're drinking and perhaps try to look for a similar drink with a lower alcohol content. This slide is demonstrating the number of alcoholic drinks that you can have to bring you up to that 14 units per week. This means that you should have less than 6 175 ml glasses of wine per week, less than 6 568 ml glasses of beer or lager a week, and less than 5 568 ml glasses of cider, and less than 14 25 ml glasses of spirits. That would be a single shot. When we think about being active, here are some of the things that most people would consider makes them active. cleaning, household activities, shopping, running jobs for the family. Keeping busy, working on your feet all day, chasing the children around. These are actually normal daily living activities, and we wouldn't consider them exercise. Being overweight or obese increases the risk of developing diabetes and high blood pressure, both of which are risk factors for cardiovascular disease. You're considered at risk for cardiovascular disease if your body mass index is 25 or above. You can use the body mass index healthy weight calculator available online to work out your body mass index. If you're a woman with a waist measurement of 94 centimetres, about 37 inches or more, or a man with a waist measurement of 94 centimetres, that's 37 inches or more, or a woman with a waist measurement of 80 centimetres, that's about 31.5 inches or more, then that's considered a little bit too high and is increasing your risk of developing heart disease. This slide is showing you things that are considered to be exercise. Exercise makes you breathe harder. Exercise gets you a little bit hot and sweaty, increases your heart rate. Exercise should be structured, so it's something that we're doing regularly at set times. Exercise is a higher intensity than the usual activities of living that we saw on the previous slide. Exercise should be challenging. If you don't exercise regularly, it's more likely that you will have high blood pressure, high cholesterol, and be overweight. All of these things are risk factors for cardiovascular disease. Exercising regularly will help keep your heart healthy. And when combined with a healthy diet, exercise can also help you maintain a healthy weight. The benefits of exercise: it can reduce your chance of type 2 diabetes by 40%, cardiovascular disease by 35%, falls, depression and dementia by 30%, joint and back pain by 25%, and cancers, particularly colon and breast, by 20%. So it's a really good idea to have regular exercise. So a summary of the risk factors and what we can do to keep our heart healthy and reduce your risk of cardiovascular disease. If you already have cardiovascular disease, staying as healthy as possible can reduce the chance of it getting worse. And ways that you can reduce your risk of cardiovascular disease are that you can stop smoking. If you smoke, you should try to give up as soon as possible. The NHS Smoke-Free website can provide information, support and advice to help. Your GP can also provide you with advice and support. They can also prescribe medication to help you quit. The local service is Stubbit, available from a GP referral. You can exercise regularly. Adults are advised to do at least 150 minutes of moderate activity a week, such as cycling or brisk walking. If you find it difficult to do this, start at a level that you feel comfortable with and gradually increase the duration and intensity of your activity as your fitness improves. Visit your GP for a health check if you haven't exercised before or you're returning to exercise after a long break. Maintain a healthy weight. If you are overweight or obese, a combination of regular exercise and healthy diet can help you lose weight. Aim to get your body mass index below 25. If you're struggling to lose weight, your GP or practice nurse can help you come up with a weight loss plan and recommend services in your area. And reduce alcohol. With regards to medication, if you have a particularly high risk of developing cardiovascular disease, your GP may recommend taking medication to reduce your risk. Be compliant with your tablets. And stress. Think about what causes you stress and what you can do to reduce that stress. What changes can you make, and how can you minimize the effects of stress on your life? Making changes. It's useful to think about where you are on the cycle of change. This is how you will know how ready you are to make the change. Finding this out can then guide what needs to happen next to move along to the next level of readiness to make a change. The cycle of change takes us from a point of pre-contemplation, i.e. not even thinking about making a change. It takes us from there to thinking about a change and then moving on to planning and making that change. The cycle moves on to actually making the change and maintaining it. Some people move up and down the cycle of change before making that change permanent and lifelong, but they learn a bit more from each experience of trying to make the change. So don't give up if you don't succeed on the first attempt. Some ways of behaving or habits may have been part of your life for many years, and it can feel like you are losing part of who you are when making a change. So try to imagine yourself as the person who longer has that way of behaviour or habit, and how life will be different from now on. Write yourself a note to remind you why you want to make that change. Keep it close and look at it often. For some people, making lifestyle change is very important, and for others, less so. Therefore, it's worth thinking about how important making that change is for you. This can be given a number between 0 and 10 on a ruler. 0 being quite unimportant and 10 being very important. It's important for you to then think about what would need to happen to move you along to that need to change becoming more important for you. If it's very important for you, then you may need little or no help in making that change. Others may need just a little bit more information or direction to a website. If this change is less important to you, then it's worth considering what might or could happen to make it more important to you. Think about what barriers you might have to overcome, who can help you make the change, and how confident you feel about making the change. Stress. As previously stated, stress has an effect on your risk of developing cardiovascular disease, and it's important to consider what stress factors there are in your life, how you can reduce them, and how you can manage stress in your life. Targets for reducing risk factors. For diabetes, we've got the recommended blood sugar range that diabetics should aim for. For blood pressure, we've got the target figures for non-diabetic and diabetic patients. 140/85 millimoles for non-diabetic, and 130/80 millimoles for diabetic. Cholesterol, total cholesterol less than 4, LDL less than 2, HDL more than 1, and triglycerides less than 2. With diet, aim to eat a low saturated fat diet, reduce your salt, reduce your sugar, and have 5 portions of fruit and veg a day. With alcohol, aim for less than 14 units with some alcohol-free days. And with exercise, 150 minutes of moderate intensity aerobic exercise per week. Keep active and cut down on the time you spend sitting. Body mass index less than 30, and a waist circumference for men less than 37 inches and for women less than 32 inches. Here are some of the places where you can get additional advice. BritishHeartFoundation.org, Diabetes UK, your own GP and practice nurse, your own heart or TIA nurse, and the government Stop Smoking website for the latest information. Thank you very much.